Kristen. How are you?
Nice to meet you.
Nice to meet you. Okay, so for your pre-op visit, we're going to take photos right now. I just need you to sit right here on this chair with the back to the white wall.
All right.
And since we're working on the face, we're going to concentrate on your face today. Okay, so we are going to do one front view. Perfect. And then I need a side profile shot, so rotate your body that way. Beautiful. Okay, perfect. We're all set.
Great.
You can have a seat over here again.
All right.
Yep.
Hello.
How are you today?
I'm doing fine, thank you.
All right, so we're here to talk about
Facelift.
fantastic. How long have you been considering?
I've been looking at the J plasma pictures, but I'm not sure whether I wanted to do J plasma for tightening, or at this point in my life I should go a little bit more for a full facelift.
Okay. Previous facial surgery, facial trauma? Anything?
No.
Skin cancers or other skin diseases? Any resurfacing or energy-based therapies on the face in the past?
I've done some non-invasive treatments on my face as far as stimulating collagen and things like that, but I haven't done
All right.
anything stronger than that.
All right. Any allergies to medications that you know of?
No.
And any issue with anesthesia in the past?
No.
Okay. All right. So I'm going to have you do a couple of things here. We're just going to go through the face top to bottom, and I know Christine already took some pictures, so we'll look at what some of the options are based on the pictures. Okay. In the end, what are your goals? What would you like to see? Staring back at you in the mirror?
I don't like my neck.
Okay.
I find that, the jawline and the corners of the mouth are my key issues when I look at myself. And my eyelids are getting much more hooded than they were before. So those are my key issues.
Okay. All right. Look at your skin really quickly. I know you take meticulous care of your skin.
I do try.
Alright, so I want you to do a few things for me. I want you to furrow real strong, lift up real strong. Your left brow goes up a little higher than your right brow. Squint really tightly for me. Alright, so tighten your eyes down, don't let me open them up. Great, relax. Alright, I want you to look straight up for me. Okay. And then close your eyes. Press on your right side a little bit and on your left side a little bit. Okay. So you can open those back up and give me a real big smile. Like this, showing one teeth. Okay. Alright, now relax. Give me a little swallow. Okay. Bring her down, back down to right neutral right. That's what I want to see. Okay, not too bad there. Okay. Alright. So when I look at your face, your skin's in overall good condition. You do have some of the dynamic lines that we all get. I would expect that. There's a little bit of brow asymmetry. Your right brow sits a little bit lower than your left brow, and even when you raise, it still stays the same. So that's just an inherent asymmetry.
Okay.
Your facial volume is generally good, but you've started to lose a little bit right down in the the area right here.
On my left eye, I see that orbital imprint
Yeah.
that I think is more obvious on
Then on the right side.
On the right side.
Yeah, it's not severe. I think there's just a little bit more volume loss right along that region. There is a little bit of fat that starts to pooch out there just from the orbital septum and weakening of that with time and age, but more of it I think is a little bit of volume loss. And I'm not a big person to do a huge amount of filling in those areas because I don't want to do it, make it look puffy, but you would benefit from a little bit of that. Yeah, your nasolabial folds are modest, they're not bad. I think the things that do stand out to me are just kind of the squaring and the heaviness of the jaw. In general, your cheek volume is pretty good. You don't need a lot of patients age and lose a tremendous amount of volume in multiple areas. So fat grafting to restore that volume is a huge tool in our kit, and so we don't have to pull so hard anymore. This is more about refinements and reestablishing normal youthful anatomy than old conventional, tighten it up as far as we can. Okay.
All right. Well,
All right. So
good.
I'm going to show you a couple of things on your face
All right.
that I think will be helpful. So as we were talking, you can see your orbital imprint and a bit of volume here.
All right.
And I don't. We'll start from the top down, but that's the thing that jumps out. You have a fairly high forehead, a long distance here. But your brow position is reasonably good. I don't even feel like we need to really go after brow raise terribly much. There's been a little bit of volume loss here, so recarpeting the forehead region with a little bit of structural fat grafting I think would be helpful. I do agree that your upper eyelids, just cleaning those up a little bit with an upper eyelid blepharoplasty with the incision right in the skin crease right there would be helpful. Okay. The lower lids, I just think a little bit of volume right along the tear trough area. Cleaning up the rest of that with some laser to re-stimulate collagen I think would be beneficial. And
and that would make an impact on these.
Yes, it will. It'll help those tremendously. There are two options as far as resurfacing. One is J-plasma and one is laser. In your case, I actually think the CO2 laser in conjunction with the facelift is a better option than the J-plasma resurfacing. I know we've had some, you have experience with that with post-op patients. You do have a little bit of volume difference left to right, and we probably just balance that out with a little bit of structural fat grafting even around here. But as we come down, this is where you start to see all of this. And this is a vertical issue. So there are non-surgical options like J-plasma subdermally, even thermi-tight, short scar facelifts. They would address this some. Probably not going to address the neck very well because I think this is all uniform. I mean, when I approach facial rejuvenation, it is best to keep everything looking as consistent as possible. So when we embark upon a rejuvenation process, I want everything to match.
That sounds good.
Okay, I think matching is critical. Because you can take a room that you know is going to take 3 coats of paint, and if you just put 1 coat of paint, it almost looks worse than if you did nothing. Okay.
Okay.
All right. So we're going to go to this, and so now you can start seeing
you can really
the
start
jowl
to see the
here,
jowl.
the neck issues, and a little bit of the banding there. So as far as incisions are concerned, incisions would be around the curvatures and contours of the ear. I don't know how much extra skin you're going to have. I may be able to just stop this in the sideburn. I may come up just a little bit higher. I don't think you're going to have a lot of shift this way, so it may be beneficial to come up into the hair here. I determine that based on skin laxity. On the neck, you'll have an incision just underneath here. I do not put it in the crease here. I actually put it just behind the crease because I want to release that and not exacerbate that when everything heals back. I will use a little bit of fat grafting through these regions to reestablish a little bit more of a softer chin contour, because you're starting to have a little bit of depression right in this pre-jowl region. The jawbone, sometimes genetically, but most often through aging, starts to thin or weaken right there, which exacerbates this depression. Okay. Incisions will come up behind the ear, and then they will taper back down into the fine hair back there. Okay. Through that, we'll resuspend the platysma muscle, clean up all of the neck area. All of this gets shifted in this direction, so you don't get creases up on the up on the face, which would look horrible. I want everything to stay uniform. Okay. You will have a drain. The drain comes behind the left ear, down along the neck. You'll probably see the contour of it underneath the skin. It comes out at 5 days, the same time any sutures come out.
So it'll be in for 5 days?
5 days. You should be able to shower with it in place.
Okay.
It makes a big difference as far as helping control swelling, especially that late swelling that as you start to get a little bit more active. that settles down in the lower neck here.
Okay.
'Cause I used to take all the drains out of day 1. I now take all of them out when I take the stitches out, day 5 or 6 depending. But it makes a tremendous difference in establishing a much better neck shape and contour, and just alleviating that swelling that can settle in, a few days later as you're getting more active again. Okay.
All right.
As far as the laser is concerned, you have a lot of experience with the laser patients. You know what that whole recovery
I do.
requires. It's attention to detail. But as long as we're paying attention to those details, supporting those cells, that should heal fine and very uniform. I will laser even over the skin flap, very light, just so everything is nice and uniform. Okay?
Okay. That's a new face.
That is a new face.
That is a new face.
100% new face. All right, now, as far as risks and complications, bleeding, infection, both very rare. Wound healing issues, unusual except for diabetics and smokers, and I know you're neither one of those.
Right.
Nutrition is really important as far as healing is concerned. It helps, especially with the swelling, and it's making sure swelling goes away as quickly as possible. Prolonged swelling is something we want to avoid. Injury to the nerves that move our face, that should be less than 2%, even in really super experienced hands. The nice thing about it is, even if there is a nerve injury, they tend to all resolve on their own over time. It just can be frustrating.
Right.
It is a very rare injury. Okay. Scars that you don't like, they are placed in discrete, very discrete areas. So once everything is healed, redness is gone, they should be hard to see. Okay. Asymmetries, our faces are inherently asymmetric. We'll try and adjust for certain things, adding a little more facial volume on the left side versus the right side, how we're shifting what's underneath. Okay?
All right.
All right.
Okay.
Right after surgery, you're going to go home. Nothing hard to drink. I like to avoid straws. I usually don't put patients in a wrap. You will be going home just like this.
All
Okay?
right.
I will see you the next day. We will review everything, make sure everything looks like I expect it should look.
Okay.
Go over and review instructions from that point forward. As far as activity is concerned, I don't mind you being up and moving around. In fact, I really feel like it's important.
Okay. It's
Just no strenuous activity.
Right.
We will review where you are from an activity standpoint at the 2-week mark. As far as back to work, I know you work here, so the benefit is that you can come back and have
I
a
can
post-op
come back
every
and
day.
work exactly.
But as far as usual back to work, I'd say most patients somewhere between 7 and 14 days, and it just varies person to person, as you know. Okay?
Okay.
As far as looking how you're going to look long term, it's going to be somewhere about 3 to 4 months. And even with the fat grafting, there is a diminishing and then what we call a trophic phase that occurs over a course of about 1.5 to 2 years. So your fat grafting will not look its best for about 2 years, interestingly enough. Okay? Won't look its best for about 2 years. The nice thing about it is it'll look fantastic regardless. Okay?
Well, that sounds good. Okay. No, I'm prepared for this. I'm mentally prepared for this. So.
Yeah, you'll do well. Surgery time, 5-ish hours.
Yeah.
You're asleep, everything's nice. Now, the nice thing about anesthesia is, all through the IV, no breathing tube is necessary, unless our anesthesia providers, see something anatomic that they, have a concern with. But that's typically what most everything is. Everything else is local anesthesia. You do wake up with a fairly numb face, which is a little odd at first, because everything is just kind of funky feeling. That should all return by that night, next morning at the latest. Most patients don't have a tremendous amount of pain. The laser resurfacing feels hot for about 2 hours. That tends to cool down. Beyond that, it's where we anchor everything, especially right down at the base of the earlobes. That's where people tend to feel the most pain, and they feel tight in their neck, which I really actually kind of want. If someone's not feeling a little bit tight in their neck, we haven't quite achieved what we want to achieve.
But with the resurfacing as well as everything else that's going on with the fat grafting, can I be icing?
So I am not a big fan of icing. Yeah, I'm not a big fan of icing. I find that it does affect the fat grafting a little bit, so I want to minimize that. Cool packs, fine. Thermal water spray, fantastic. You will have a little collagen mask on. You'll have the PRP underneath that to help, from an inflammatory standpoint. And we may use the liquefied amnion as well. Okay, I think all of those things make a big difference.
Yeah.
So I don't think you're going to need the icing from a comfort standpoint. If you do, you can put it kind of forehead, those areas, just not in the heavily grafted areas. Okay. All right. So there'll be a pre-op visit about 2 weeks ahead of time. Good nutrition up until then and beyond. Probably one of the best things you can do. You'll get a phone call from the nurse the night before to go over specific immediate pre-op, and any other questions, you know where to find me.
Exactly. Okay.
All right?
All right.
All right, whole new face.
Whole new face is right.
Fantastic.
Thank you. Thank you very much.